Michael, thank you very much, and thanks to your staff for just an outstanding effort. And Peter, I just ditto on your leadership with the planning committee. I feel like the youngster in the room, not because of chronological age, but just in terms of experience. And so I'm very, very enthusiastic about our day. I'm a little surprised, though, about one thing, and that is that I have Pastor Bruce to my left. And so my authenticity is on high alert, and I'm just kind of wondering, Michael, what I did in the past that would... You're monitoring me closely, I know, Absolutely. Pastor Bruce, yes.
We're bound by a strict code of confidentiality here. Yeah.
Thank you. Just a little bit about the Peterson Center on Healthcare, and then I'll turn it over to Peter. Pete and Michael Peterson, New York City. Pete was the co-creator of Blackstone Venture Capital. His life has been both in the public and private sector. His interests are to do things that will enable this nation to thrive. He's quite concerned about federal expenditure. He's quite concerned about federal expenditure as it pertains to healthcare. But as he put together his public and his private sector experience, he realized that in healthcare, the answer is how to accelerate value, how to accelerate value improvement. I was asked 2 years ago to come in and help him and Michael Peterson shape and oversee the center. And with my experience primarily in hospitals, but especially with my experience with the Institute of Healthcare Improvement for 3.5 years, realized that it isn't really about inventing new models, it's about finding them and validating them. The gems are out there. We have people in this room who embody those gems. And so, as Michael said, our interest is finding them, identifying them, validating them, and then going about the process of spreading them such that the exemplars become the national standard. It's an audacious goal, for sure. And not one that obviously we can do by ourselves. That's why you see several other foundations and an interest in a collaborative effort to move us forward. Certainly policy is a critical issue in this, creating an environment whereby there's a tailwind, as Arnie Milstein will say, in pushing us towards those spreading of those higher value models. And higher value in terms of outcomes, experience of care, clinician engagement, and total cost. Our interest is to learn how to transfer know-how, the practice, and syncing up the practice with the policy. Our strong belief is that you need both. And if you don't have both, there will be unintended consequences. So our interest here today, our interest in our third workshop, our interests beyond the National Academy of Medicine's work with us, is to have models that we can spread collaboratively. So my hope, my interest, my exhortation, if you will, is that we think about that in our work today. We think about how is it that we're going to move beyond the identification and the validation into the actual spread of whatever it is that we feel warrants being spread. Again, thank you all for your participation, and I would say your inspiration and your commitment to this ideal. And Peter, I'll turn it over to you, and thank you again for your leadership.